we want to have question and answer time, I can go through 2 slides, I can go through all the slides. It's whatever is most helpful for you guys, okay? Perfect. So, just briefly today, I'm going to talk a little bit about the basics of genetics. We're going to start at the very beginning, the genetics of cTTP, and then what genetic testing and genetic counseling looks like, as well as some resources for you guys. Is this better? Okay. Sorry, I'm very soft spoken, so just yell at me if you need me to be louder. All right. So, starting with the basics of genetics, I think this is kind of a silly way to think about this, but Legos, cake, if you're making a cake, building furniture from IKEA, all of these things, you need instructions or a manual or a recipe, right? Your body needs that too. So, your body is made up of cells, and in you have trillions of cells. In all of your cells, you have your DNA. It's packaged into chromosomes, which you have 23 pairs of chromosomes. And then your DNA is inside your chromosomes, and it's made up of genes. The way that I like to think about genes is kind of like with the alphabet, we put together different letters to make words. For genes, we take these DNA molecules, these A's, T's, C's, and G's, and put them together to make a gene. We probably all have different mutations in our genes, and most of the time, these don't cause any health concerns. They're just normal variation from person to person, right? Um, but we can have different changes that substitute in different letters, delete letters, um, insert letters, or switch these letters around. And sometimes these don't cause any problems with the way that the gene works, just normal variation. Other times, these can actually cause a problem with the way the gene works. So, moving on to the genetics of cTTP. As you all know, the important gene for this is ADAMTS13. It is located on chromosome 9, and this is an important gene that gives instructions for making an enzyme that is involved in regulating blood clotting. Everyone has 2 copies of the ADAMTS13 gene, so you get one from your mom, one from your dad. In order for someone to have congenital TTP, both of their parents need to be a carrier for this. So they have one working copy and one non-working copy of the gene. When both parents are carriers, there's a 25% chance for them to have a child with cTTP. There's a 50% chance that their children could be carriers, or there's a 25% chance to have a child that inherits both working copies. And this is important to just keep in mind that this is for each pregnancy that the parents have. It's that 25% chance. So that's how we see multiple siblings who all have cTTP. You can inherit 2 of the same gene changes from each parent if they have the same exact genetic change. Or you might have a parent who has a change in one spot in the gene and a parent who has a different change in the other spot. Okay. Any questions about anything we've talked about so far? Okay. So, and inheriting those 2 changes is what causes your ADAMTS13 gene to not be able to kind of chop up that circulating von Willebrand factor, and what causes those symptoms and those tinier blood clots in the vessels. Oh, I don't know what happened to this slide. There should be more information on that, but this is okay. We'll talk through it. There is limited evidence to suggest that the genetic changes that you have will tell us when you may present with cTTP symptoms. So based on the genetic changes, we might be able to say, is this someone who's going to present in childhood? Is this someone who's going to present in pregnancy or adulthood? This is not a perfect science, and we don't have a ton of information in this area, but this is where something like a registry would be really helpful, because then we would be able to maybe delineate some of this a little bit further. Sorry, I think I saw a hand raised. No? Okay. Okay. All right. Okay. Let's see. So, moving on to genetic testing, it's most helpful for us to test the ADAMTS13 gene. That's the only gene that we would think we need to test for someone with cTTP. You may also see people who are tested on a larger genetic testing panel looking at genes that are associated with all different kinds of TMAs. Thrombotic microangiopathy. So we see that with like TTP and then HUS as well. Okay. Not sure what happened with my graphics when we transferred the slides. I'm so sorry. Um, but there are different sample types we can use for genetic testing. Okay, that's fine. We'll pause for a second. Oh no! It must have been when I uploaded it. Things got lost. I can talk through it. It's fine. That's fine. I'll just keep talking. So we can use different sample types. We can use a blood sample for genetic testing, which is probably most commonly what you see. We can also do it's called a buccal or a cheek swab, where we swab the inside of your mouth and we're able to get DNA that way. And then during pregnancy, some people may want to do what's called an amniocentesis, which is where they take a sample of fluid from around baby and they're able to tell if this is a baby who has that genetic condition or not. Genetic testing can have a longer turnaround time than some other testing. Like an Adams level, which may come back a little bit more quickly. Genetic testing can take about anywhere from 2 to 6 weeks to come back. Um, and that's because once they receive a sample, they do have to take the DNA out of the sample. And then in the lab, they sequence it. So they look at that gene letter by letter and read through it, and then also compare it to the general population to look for differences. Once they have all that information, they have to write everything up in a report. And so from start to finish, it can be a time intensive process. It's important to keep in mind in genetics, we are building the plane while we're flying it to a certain degree. No test is perfect in genetics, even if we're just looking at one gene. So it's important to make sure that when a test is ordered, we know the methodology of the test. So your healthcare provider should be able to talk through that with you. And then also keep in mind that there are times where we suspect that someone has a congenital TTP and we're only finding one variant. Um, and that could be because we actually have to do a separate analysis or a different analysis of the gene to find that second genetic change. Based on like if you had the low ADAM-TS level and then no inhibitors, we would suspect someone has congenital TTP. But if we're only seeing one variant, it may be they truly only have one variant and this is not congenital TTP. Or it could be that the type of genetic testing we did wouldn't have identified a second genetic change. That is a great question. So these genetic tests, most genetic tests are going to sequence the gene. So they're going to look letter by letter and look for any extra letters or missing letters, anything that would cause a gene to not work properly. What some tests will automatically include is this deletion duplication testing, which is where they're looking for missing or extra information that may disrupt the gene function as well. So you want to make sure that the testing was a more comprehensive analysis through sequencing it with deletion duplication testing. Okay. Any other? Yeah. Mhm. That's okay. We have that in common. So your question is: you tested your daughter, and do we need to worry later down the line? How was she tested with Adam TS13 genetic testing or the level? That's good. Mhm. Mhm. I think an Adam TS13 level should be um, okay. We will see people who are carriers for TTP have lower, like 50 to 70% levels. And so we don't expect them to have any symptoms of cTTP, but I think this is an area of interest and kind of like learning that we can do. And I think with what Dr. Chnot was talking about with the registry as well. Does that answer your question? I don't think you would need for your daughter. I don't think you would need to do any additional testing. She may want to talk with like a prenatal genetic counselor way, way, way in the future. I know she's little right now. Well, if you have cTTP, you always pass on one of those genetic changes. So we expect that all of your children are carriers. Um, so for them to just keep that in mind for their own family planning in the future, they can meet with a prenatal genetic counselor, get their partner tested, and see what their chances for a child to have cTTP. Okay. Yeah. Oh, okay. Huh. Oh. Oh, wow. Mm-hmm. Yeah. Yeah, there are some more common clotting disorders too, so it would may be helpful for him to be tested for that as well. Hmm. Okay. Hmm, interesting. I would definitely recommend genetic counseling if they're interested, but all right. Any other questions before I move forward? You guys have had a lot of great questions, so all right, we're gonna skip this slide since it didn't work out the way I wanted it to, anyways. So there are three different kinds of results we can get from genetic testing. The first result is a positive result. So we can see either one or two Adam TS13 variants. So that person who had genetic testing is either a carrier or has a diagnosis of cTTP. Um, Genetic testing can be really, really helpful, especially in these cases where the presentation is maybe a little less clear between acquired and cTTP. And family members, may wish to get tested to know their status for their own health care and then their future family planning as well. And we've already talked about how genetic testing is not perfect. We can also get a negative result. So this means that the person is unlikely to be a carrier or to have cTTP. It's more reassuring to get a negative result when we know the specific genetic changes in the family and we're able to give that information to the lab and say, this is what we need to test for. And that gives us that clear yes or no. Because the methodology differs between the different labs, we want to make sure that we know the specific genetic change in the family and can give that information so that they can test for that. Mm-hmm. That would be helpful, I think, to confirm if it's a true negative or not. Um, we can also get the ever confusing variant of uncertain significance. So, this is when we're seeing that there's a genetic change there and we don't have enough information to say whether or not this genetic change would actually cause TTP or not. And this becomes even more confusing, I think, sometimes when we have someone who has symptoms and has maybe one pathogenic variant and then has one uncertain change. Um, the way that these variants are scored is on a system where basically you have points that push you out of the uncertain category. And those points will either push you towards something we think causes disease, or it'll push you towards something that we think this is actually benign and more common. So maybe unique to you or unique to your family, but we wouldn't expect it to cause any health concerns. These can be really frustrating for patients, I think, and healthcare providers, honestly. Um, and it's one of those things, I think, where we think genetic testing should be super certain and that should be very clear. And then we sometimes still end up in this gray area. But with VUSs, sometimes it does take a couple years for the science to catch up and for us to learn enough to say what category this falls in. All right. So I will talk a little bit about what I do, which is genetic counseling. And there are 3 different specialties, kind of a larger umbrella specialties. So there's adult, prenatal, and pediatric. And so you may see a genetic counselor as a child, maybe with your own family planning, and then also in adulthood. It's one of those things where you may just follow with genetics throughout your lifespan, and we're available at all those different time points. For a typical appointment, it can be really helpful to bring any records, any family member records, personal records, genetic testing records. You may meet with a hematologist, you may meet with a geneticist. It just depends on what the workflow of that clinic is. You may just meet with a genetic counselor that day. Depending on the workflow of the clinic, you may be able to get genetic testing drawn that same day. It may be something that they wait to talk with your insurance after the appointment and they make their final recommendation. Genetic counselors love to draw out your family history. We want to know all the family medical concerns, all the drama. Bring it to your appointment. We will take a lot of time asking you family history questions. And I think this is something that can be overwhelming if you don't know a lot of your family history. So it's also important to keep in mind that we ask a lot of detailed questions, but you don't have to know everything. And frankly, a lot of the questions that I ask patients in clinic, if you were to turn around and say, Hannah, what about you? I would look at you like, oh, I don't know. So it's okay. Bring what you know, gather as much as you can, but don't feel intimidated if you don't know the answer to a question. With genetic testing, if it's already done prior to the appointment, they will review the report for you. So this is a sample of a genetic testing report. Um, it has, the patient's name, and then the testing that was done is under test description, the sample type, and then it lets us know actually here the result. So this is the gene. This is the specific genetic change. This is exactly in this ADAMTS13 gene where there's a change. And then this is the protein information. So it's kind of like an address in the ADAMTS13 gene that tells us, okay, this is where we would need to look in other family members at this specific address. Genetic counselors can also help you share this information with family members. So I hear from a lot of people, so and so doesn't want to go to the doctor, doesn't, really believe me when I talk about this information. And so we can provide a family letter that basically briefly breaks down, this is the condition, this is the risk to you, and this is why you may want to be tested and how you would go about testing. Um, and that way you can feel like, and it's also usually signed by your genetic counselor or your clinic. And so it's providing that information to your family members in a way that they have it in writing and they know what they need to do. And so it's up to them. We can also provide a counseling letter to you, just detailing everything we talk about, because you guys have a lot of doctor's appointments. You have a lot to remember. So having just a physical copy can be really helpful. Okay. All right. I want to specifically talk a little bit about prenatal genetic counseling because this can be helpful for patients with cTTP who are thinking about having children or family members as well. So we can do testing to see if we're carriers for anything else. So we already know, maybe we already know we have cTTP, but we want to know, are we carriers for any other health concerns that we wouldn't know about because we don't typically have symptoms of being a carrier. So we can do these larger carrier screening panels that would tell us, are we a carrier for things like maybe cystic fibrosis or sickle cell disease? That if our partner's a carrier, then there's a 25% chance to have a child with that condition. We can also find out, is our partner a carrier for cTTP? And is that information that would make it, more likely than 25% to have a child with cTTP. It is important to just keep in mind, if you do carrier screening, ADAMTS13 may not be on all carrier screening. Last I looked, it's on a decent number of the panels, but not all of them. And so if your provider orders like a 600 gene panel and you're like, surely it's on there, double check. We are probably all carriers for some genetic condition. And so I recommend this to anyone who's thinking about having children and just wants to know their chance to have a child with a certain condition. Can be helpful outside of cTTP for that reason too. Yeah. Oh. Mhm. The I think we do see autoimmune conditions in particular kind of cluster in families. And is that because we know they have a true like pathogenic variant that explains that? Or is it because the immune system's really complex and so maybe there are some genetic risk factors, but then we have some environmental or societal like factors that also kind of work with those genes to cause those autoimmune conditions. Um, so there is some genetic testing for autoimmune and kind of disorders of the immune system, but I would say that's one of those areas in genetics we do have a lot to learn and a long way to go. What other questions do we have? I think that does bring up an important point about carrier screening, which is these are more things that are childhood onset. these aren't typically things that we see people develop later in life. So typically we'll test these for things that would be we would test parents for things that would be childhood onset and would likely be actionable or something that the parents could there would be a medical intervention that would be helpful for that child. Okay. Um, Briefly, some people will choose to do prenatal genetic testing where they actually test an embryo. Um, and this is helpful when you know the specific genetic changes in the family. Um, and then they're able to do IVF, where we take the egg and the sperm together outside of the body, create an embryo. We're able to do testing to say, is this an embryo that has this genetic condition or not? And then implant for pregnancy at that point. This can be extremely expensive, um, but there are certain grants or some insurance companies or employers will offer benefits. And so this may be something to talk with your provider about if you're interested. Yes. Because because the parent who has cTTP has two copies of those genes and both of them have a change in them. So that's just a 50-50 chance which one they pass on. And since they both have a change, that child's always inheriting a change for cTTP. And so they'll all at least be carriers. No, we wouldn't expect them to present with any symptoms. Yeah, depending on their partner status, then they have a 50-50 chance to pass it on to their children. And then it kind of goes from there. Sorry. Oh. Mm-hmm. Okay. Yeah, genetic testing it can be expensive. It's getting better. Insurance companies are, I think, coming around to the idea of genetic testing and offering this because it helps us inform other family members. It helps us inform the treatment of the patient too. Um, as far as protections for genetic testing, this is what stands right now. And I think we've seen too that these things can change. But the Genetics Information Non Discrimination Act of 2008 protects us from our health insurance and our employer using our genetic information to basically like make any employment or coverage decisions for us. So there are caveats to Gina though, because there are caveats always, right? So things like life insurance and disability, this information is available in your medical record, and it can be accessed by those parties. Um, the other thing is like there's some other smaller caveats. If you have federal insurance or you're in the military, Gina does not apply to you. Um, if you have Native American insurance, and then also, there's another big one. If you work at a company of less than 15 people, so if you are at like a startup, it's really small, Gina does not apply to you. Yes. Mm-hmm. Okay. They do. Mhm. Mhm. Absolutely. Mhm. Oh, good. Mhm. Mhm. Wow, okay, that is very good to know, thank you. Oh, okay, great, that actually makes me feel a lot better. Um, and I think you bring up an important point, which is genetic testing is always a personal decision. Um, you never have to get genetic testing. It should never be something that you feel is like, "Oh, I have to do this because I think there are reasons to consider it, before changing your medical management, um, or for your other family members, but ultimately, genetic testing is always a personal decision. Yes. Yes, and there are programs like that for genetic conditions where, someone may offer you, like, a sponsored genetic test where they're paying for it and they're keeping the data for research or things like that. What other questions do you guys have? None? Okay. Alright. So these are some of just the frequently asked questions that I get, and I think we talked through the first one, a little bit, so thank you for your question. No, that's I'd rather you ask it than me do this. It's important. Um, okay. I think we talked a little bit about this too, but if your genetic testing is negative or uncertain, but you have symptoms, that requires just a little bit more research into the type of testing you had and if there's anything else that we should be doing. Um, if you don't, so what happens if you don't know your family history or have genetic testing records? That is okay. You can still meet with a genetic counselor. We will work with the information you do have, and we don't necessarily need genetic testing records for the family to do genetic testing. It can just be helpful to give that clear yes or no answer. We're picking up the genetic change in the family. Um, so there's always a caveat if we do genetic testing for someone without those records. Okay. Um, I think a question I get often is, should I test my child to see if they're a carrier? And like I said, we have the information that if you have cTTP, we expect your child to be a carrier at least. Um, so knowing whether or not they have one of the specific genetic changes you have, it's not necessarily something that is super important to do in childhood, but we could. And then typically we say, okay, let's wait till someone's maybe 18 or older, where it would be something that's more relevant for them from like a family planning perspective. Um, I think you'll see some genetics clinics are willing to test people who are younger for carrier status, whereas others prefer to wait till they're 18 and can make the decision on their own. Okay. All right. This is another question I get a lot in clinic, which is, will there be a gene therapy for cTTP? Um, I think we're a long ways away from this, but I think maybe someday. Any other questions that you guys have for me today? It's okay if you don't. All right. Well, thank you, and I'll be around, so if you have any specific questions, feel free to come find me.